Sarcoidosis. All right, students, today we're going to discuss sarcoidosis. This is an important topic, and you'll see it often in clinical practice. Let's break it down step by step. Definition. First, what is sarcoidosis? Sarcoidosis is a chronic inflammatory disorder. The exact cause is unknown, but it's characterized by the presence of non-caseating granulomas in affected tissues. While it can involve many organs, the lungs are most commonly affected. Etiology and risk factors. Now, what causes sarcoidosis? And who's at risk? The exact cause isn't clear, but it's likely triggered by an unknown antigen. Certain groups are at higher risk. It's more common in young African American women. Most cases occur between the ages of 20 and 60. Pathophysiology. How does sarcoidosis develop? It starts with an unknown antigen, which activates dendritic cells and macrophages in the lungs. These cells present the antigen to CD4 T helper cells, triggering an immune response. T cells proliferate and release cytokines like IL-2 and IFN-gamma, leading to granuloma formation. Granulomas are clusters of immune cells, including epithelioid cells, transformed macrophages, and multinucleated giant cells. Lymphocytes, monocytes, mast cells, and fibroblasts surround these cells. Over time, these granulomas can cause fibrosis, leading to organ damage. Also, activated macrophages increase 1-alpha-hydroxylase activity, raising 1,25-dihydroxyvitamin D levels, which can cause hypercalcemia and sometimes kidney problems. Clinical features. What are the signs and symptoms of sarcoidosis? Pulmonary symptoms are the most common. Persistent dry cough, shortness of breath, especially with exertion, vague or pleuritic chest pain. Extrapulmonary symptoms include skin, erythema nodosum, tender red nodules on the shins, and lupus pernio, a purplish rash on the face. Eyes, anterior uveitis, which causes redness, pain, and sensitivity to light. Heart, rare but serious complications like heart block, arrhythmias, and cardiomyopathy. Diagnosis. How do we diagnose sarcoidosis? Start with a chest X-ray, which often shows bilateral hilar lymphadenopathy, a hallmark sign. Confirm the diagnosis with a biopsy, which reveals non-caseating granulomas. Lab findings may show elevated serum ACE levels, hypercalcemia, and increased vitamin D levels. Management. Finally, how do we treat sarcoidosis? In mild or asymptomatic cases, no treatment may be necessary, as it often resolves on its own. For severe symptoms, glucocorticoids like prednisone are the first-line treatment. If steroids don't work, we use immunosuppressants like methotrexate or infliximab. In extreme cases, with severe lung damage, a lung transplant may be needed. Thank you, and stay tuned for more videos.